Andrew, bergamot is being sold like a citrus shortcut for cholesterol. Some posts make it sound almost drug-like, and others say it is just Earl Grey branding with capsules attached. Before anyone asks whether to buy it, what is the cleanest evidence-based question to ask first? Lower LDL, better heart outcomes, or just a nicer-looking supplement label?
The clean question is, does a defined bergamot extract move LDL cholesterol enough to matter for a specific person? Bergamot is rich in citrus polyphenol. After digestion, those compounds and their metabolites are handled through the gut and liver, where cholesterol production, while handling, oxidative stress, and inflammation signals overlap. That is biologically plausible, especially for lipid biomarkers, but plausibility is only the entry ticket. The trial has to show the body actually changes in humans. The most favorable synthesis is a 2022 network meta-analysis of nutraceutical trials. It ranked bergamot near the top for LDL lowering, with an estimated reduction around 1.21 millimoles per liter, about 47 milligrams per deciliter. That size gets people's attention because it is not a tiny lab wiggle. But the authors immediately warned that bergamot's estimate came from a relatively small study group. So the signal is interesting and hypothesis strengthening, not definitive enough to promise a result. Then the plot gets less tidy. A 2025 randomized double-blind trial tested a combination product with plant sterols, bergamot extract, artichoke extract, and hydroxytyrosol in low-risk adults with mild high cholesterol. After 4 months, LDL was not significantly different from placebo, and secondary lipid and safety markers were not improved either. So bergamot is not a guaranteed LDL button, especially inside complex blends where ingredients may interact, dilute the signal, or simply underperform in that population.
So if one review looks exciting and one newer trial is flat, should viewers assume the extract failed, or that different products are almost different interventions? Because a bottle can say bergamot, but the study might have used a specific polyphenol fraction, a phytosome, or a blend with artichoke and other compounds.
Exactly. Several positive studies used bergamot with artichoke or other nutraceuticals. A 2024 trial in 90 people with suboptimal cholesterol reported improvements in total cholesterol, LDL, non-HDL cholesterol, triglycerides, inflammatory markers, and some vascular or fatty liver indexes. Earlier bergamot artichoke work also reported LDL and waist-related changes. That is useful because real products are often blends. But it cannot prove bergamot alone caused every change, or that every blend with the same headline ingredients will behave the same.
That matters because the online leap is usually, can I use bergamot instead of a statin? If someone has diabetes, prior heart disease, very high LDL, kidney disease, or a clinician already recommending medication, what should they not do? And is natural any protection against medication interactions?
They should not self-replace proven therapy. The best fit bergamot conversation is usually lower stakes. An adult with mildly elevated LDL, low short-term cardiovascular risk, and no urgent indication being ignored. Ideally, they're already working on dietary pattern, fiber, exercise, weight, sleep, blood pressure, and tobacco avoidance. Then a defined supplement becomes a testable adjunct. The goal is a measured lab change, not a feeling, because most people cannot sense their LDL. There's also a newer obesity-focused meta-analysis of 11 randomized trials using citrus bergamot-containing nutraceuticals. It found significant reductions in body weight, BMI, and waist circumference, but heterogeneity was high for weight and BMI, meaning the trials varied a lot. Subgroups looked more favorable at 12 weeks or less, doses of 600 milligrams per day or less, in adults with overweight or obesity. That sounds promising, but it is not the same as saying bergamot is a reliable weight loss supplement for everyone. Here is the compression. Bergamot evidence is mostly short-term biomarker evidence. LDL, triglycerides, waist, glucose, liver enzymes, inflammatory markers, and endothelial measures appear in studies. Those markers can matter clinically, but they are not the final scoreboard. What we do not have is long-term proof that taking bergamot prevents heart attacks, strokes, diabetes, or liver failure. That distinction should govern expectations and advertising language.
If someone and their clinician decide to run that measured experiment, what should they look for on the label? Is this about eating bergamot, drinking Earl Grey tea, or using standardized capsules? I worry people hear citrus and assume any pleasant food exposure equals the concentrated product tested in a trial.
I would look for a clearly named extract, amount per day, standardization language when available, third-party testing when possible, and a full ingredient list. Safety-wise, check with a clinician if you take statins or other lipid drugs, diabetes medications, anticoagulants, or multiple prescriptions. Also mention upcoming procedures. Supplements can differ from study products, and a product can be marketed as natural while still creating interaction, purity, or dosing problems.
How would you keep the experiment honest? People can change diet, lose weight, start walking, cut alcohol, and then give the capsule all the credit, right? Would you want a baseline lipid panel, a follow-up date, and a note about what else changed during the same window?
Yes, use the same lab if possible. Repeat lipids after roughly 8 to 12 weeks, and decide in advance what would count as worthwhile. That could be an LDL drop large enough to change the overall plan, not just a tiny fluctuation. If LDL drops meaningfully and no safety issue appears, it may be a useful adjunct. If LDL barely moves, triglycerides worsen, glucose changes unexpectedly, or the product is expensive, the honest answer may be stop.
Who should pause before trying it at all? I am thinking pregnancy, breastfeeding, liver disease, surgery, photosensitivity concerns, or anyone stacking several cholesterol supplements, because each one sounds natural. And should people be especially careful when a product hides bergamot inside a big proprietary blend?
That is the right caution. My bottom line, bergamot extract is not empty citrus marketing because there are plausible mechanisms and some human biomarker trials with lipid signals. It is also not a proven statin substitute or cardiovascular outcome therapy. The most responsible use is narrow, a defined product, a specific risk context, a time-limited trial, repeat labs, and medication and product quality checks before enthusiasm. If the claim sounds cleaner than the evidence, slow it down.